Good day friends, I'm Dr. A.S.K. Gupta and I'm going to demonstrate to you a case of cerebellar encephalocele in this patient who is around 40 years of age and about 35 weeks of gestation, and she has come to us for the ultrasound for the first time during this pregnancy. If you see carefully, then this skull is a slightly small skull for this gestation, and the lateral ventricles are small in size. They do not appear to be normal. If I tilt my probe slightly towards the posterior side and I find that there is a defect in the calvarium, this is the calvarium bone and this is the defect. And through this defect, you can see that the cerebellum, vermis, etc., they have herniated outside the calvarium. This is the calvarium over here, and this is the defect. And through this defect, you can see that the brain tissue along with the meninges has herniated. These are the meninges, and this is the brain tissue, and this is the cerebrospinal fluid. So this is a cerebellar encephalocele. Now let us try to see the spine of the patient, and we find that the spine is defectless. There is no open spinal defect, but at the back of the neck we find that there is a cystic swelling, and this cystic swelling is nothing but this is the cerebellar encephalocele, and it has given rise to the small skull or the microcephaly. When I try to measure the head circumference, I find that the head circumference corresponds to nearly 30 weeks of gestation, while the patient has a gestational age of around 35 weeks. So it means it is a case of microcephaly. Come across any open neural tube defect, we should always look for the presence of polyhydramnios, but here we find that the amniotic fluid is not increased and it is AFI was 11.38 millimeters. If there is evidence of any congenital anomaly in any patient, we should always look for the other congenital anomalies. Here we find that the heart is normal in size and it is normally beating, and there is apparently no congenital heart anomaly. The heart is normal, it is normally beating, and there is no evidence of any congenital heart disease. These appear normal, there is no evidence of any pilectasis. The bladder appears to be normal in size and well filled. The umbilical cord is 3-vessel cord and is normally attached to the placenta. Placenta is anterior and there are no placental anomalies. The abdomen is well seen and the gallbladder is well seen. There are no intra-abdominal defects. So we are dealing with an isolated case of cerebellar encephalocele at an advanced gestational age. I hope you like our video. In case you like our video, please do not forget to press the like button. Share the video among large number of your friends so that maximum people can be benefited. Thank you very much.